Okay, good afternoon, everyone. Welcome and thank you for joining us. I can see people coming in through as attendees, so we'll just give people a couple of minutes to come through. But while we start, my name is David McGlashan, so I am Head of Sales and Marketing at the School for Social Entrepreneurs. Thank you for joining us today. It's always a bit of a worry when you schedule anything for August that absolutely no one will turn up because everyone's on holiday or they're ferrying kids around to holiday clubs and everything like that. But I can see numbers are filling in quite nicely. Just to explain the technology that we are using today, and I'm reminding myself of this because I haven't used this for about 18 months. So this is Zoom webinar, so slightly different to a Zoom meeting. The only thing that you need to know is there's lots of opportunities for questions. We'll have time for questions at the end. If you have questions as we go, please feel free to answer them. On your, I think it's called taskbar, on the bit at the bottom, there's a button there for Q&A. So if you just hit the Q&A, that will fire the questions through to me, and then I can ask them. But without further ado, so we are discussing social enterprise in health, opportunities and challenges. And absolutely brilliant. We've got 3 SSE fellows with us today who can sort of share some of their experiences navigating the health sector. So all 3 have been through a program at the School for Social Entrepreneurs. In fact, I think all 3 of you were on the same program about a year ago, which is really rare actually for that to happen. But we have Jamie Sadler, who is co-founder of Men's Pie Club, Maddie Kitchen, who is director of Sobriety Films, and Anatole Johansson, who is founder of, I'm going to say Sext. Is that right? Am I saying that right?
Well, SXT, yeah, it was a name that we wanted to incorporate sex and text message, and nobody wanted sex in the title. So yeah, it's SXT, yeah.
Yeah. So format for today, I'll ask each of the panelists to do an overview of themselves and their organisations. I've got reams and reams of questions that I've prepared 10 days ago before going on annual leave. So I will be going through those as we go. But like I said, please do feel free to use the Q&A button to ask any questions as they come. Anatole, over to you. Do you want to tell us a bit about yourself and about SXT?
Okay, well, yeah, thank you, David, and welcome everybody. So yeah, my name's Anatole S Menon-Johansson. I'm a consultant physician in Guy's and St. Thomas's. That's my sort of day job. I'm a clinical director for the young person's charity Brook, which delivers sexual reproductive health across England. And then in my spare time, as a sort of side hustle, I set up SXT. And the gaps we were addressing were the fact that when someone's diagnosed with a sexually transmitted infection, we try and get them to alert their partners, their sexual contacts, of their risk, and then bring those individuals into care. And what we found was people were embarrassed about doing so. There was, all sorts of stigma and shame associated with that. So, yeah, we built a platform. I can conceive the idea of having a signposting platform to local appropriate clinics. And then we allow people to anonymously inform their partners by text or email. And then we quickly heard back from partners, oh, thanks for letting me know the not so good news, but I can't get into a clinic. So we then built a booking module so that we could support those individuals to get into clinic. And we've got real-time outcome metrics coming out the back end. And yeah, so we started selling the partner notification tool in 2016, a real finger in the air job about how much we should charge for that. Obviously, it's hard to do business with the NHS in the sense of getting people to pay. You have to prove what you're worth and the value you're adding. And it's taken, and then the booking module went live in 2018. But we now have a platform that, in theory, this year we break even for the first time. So it takes a while. Part of it takes a while because I have 2 full-time jobs, well, 1.5 jobs, and doing this as a side hustle. But the second is just, getting enough evidence to prove value and to then get yourself over the line in terms of those discussions. If I could change anything to make the system better, I'm jumping straight to your questions, David, but, there's there's a lot of reinventing the wheel when you talk to new commissioners about, you know, data privacy, security, and you know, there's a lot of things that need to be signed off again and again. So a little bit of harmonization wouldn't go amiss. Getting people to pay on time would be useful, or getting people to pay up front. That would be something that'd be nice to solve. And then, yeah, just more conversations about where social enterprises could add value within the healthcare infrastructure. I think there's tons of opportunities, as I can see from this year's NHS Clinical Entrepreneur Scheme. There's lots of people with great ideas, and it's just getting those things off the ground. Sorry, I could speak all day. I won't. I'll pass on.
You know, you when you said you did it in your spare time, I thought, how on earth do you have enough spare time to do that? And it's interesting because you've come from a health background as a medic, and have you found that's worked to your advantage as you are navigating the system, or has it not been a factor?
Oh, it certainly has. So in the last 10 years, you know, public health has deteriorated in terms of the rise of STIs, if you use that as a metric. The only thing that's come down is HIV diagnoses, so we still have 6,000 new diagnoses a year. Half of them are transmitted in the UK. And genital warts, anogenital warts has come down slightly because of the vaccination. But you know, gonorrhea has gone up 300% in the last 10 years. Syphilis is now at all-time high. It's just about across 10,000 diagnoses in England. So being inside the system, you realize what the pressures are in terms of, you know, delivery of service. You obviously know who to talk to, you know how to test things, you know, so those are the valuable things. The hard thing about it is that you're in the system. So actually convincing people in the system to use things, you know, like online testing or partner notification digitally, you know, people are, you know, they see new ways of working always as a challenge, and you know, and trying to communicate the message that we could do more with less time, you know, with these tools is obviously another ongoing challenge. And yeah, just things move slowly in the NHS.
Thank you. Jamie, if I could come to you now, tell me all about Men's Pie Club.
Yeah, sure. Afternoon, everybody. So Men's Pie Club, well, Men's Pie Club is actually a project of Food Nation, and Food Nation is a social enterprise that I set up getting on for 20 years ago now, which is pretty scary. And basically the work that we've done has been very much focused on tackling health inequalities. But since COVID-19, we've focused literally exclusively on Men's Pie Club and trying to grow that. So Food Nation changed dramatically during COVID-19. We lost a lot of contracts and the whole carnage of that. And one of the things that one of the things I was really keen to do, because we knew how much potential Men's Pie Club had, is that we thought, right, okay, let's focus on this one project and see if we can really make it work. So we've got, you know, pretty lofty ambitions for what we want to try and achieve, and you know, our big goal, our ambition is to make Men's Pie Club a household name across the UK, and have a presence in, you know, lots of different communities. So what is it? So basically, Men's Pie Club uses pie making as a vehicle to try and support guys at risk of social isolation and loneliness. And we do that by setting up and running weekly male-friendly, and that's really key, male-friendly social clubs where men can come together, cook, bake pies and eat together, and ultimately connect, make new friendships. So again, one of our key aims obviously is around trying to enhance men's health and well-being, very much through through strengthening their social connections, building their skills, and really trying to create that genuine sense of belonging for them as well, which is really important. And I say that we run weekly clubs. That's not strictly true, because one of the key elements of Men's Pie Club is that our clubs are actually volunteer and member-led, and that's really, really important. So peer-driven, they're shaped by the communities that they serve, and many of our leaders, as we call them, bring a lot of lived experience of mental health challenges, caregiving, or recovery. So it works really, really well, and we work in partnership with a lot of different community venues to embed the clubs within communities. And so the usual suspects: community centres, community libraries we've got clubs in. We work with a couple of businesses as well. So for example, we've got a pie club which takes place in a tap room and a microbrewery up in County Durham, and community cafes, and various other places. And then finally, just to say, what's really, really important for us is collaboration and working in partnership with a wide variety of people and organizations in the communities where pie clubs are based. So we rely a lot on other charities, social enterprises, mental health teams, GPs, referring or directing guys to us to become members. So that's Pie Club.
Thank you. And actually, that was going to be one of my questions, Jamie, is that when people say health, I think instinctively they think NHS, just because of the way that health is set up in this country. And I was going to ask about your interaction with the NHS and whether you do get referrals from there. And I think we'll come on to that in more detail later.
Yeah, no, absolutely. And just on that as well, I think what I'm really trying to get across when I describe Men's Pie Club. So we're not a mental health project. We're very much, so again, I said before, social connectivity. So we're very much about social health, which is really, really important to our overall health and well-being. And of course, if you've got good social health, that does impact positively on both your mental health and your physical health.
Thank you. Maddie, over to you.
Hello. So my name is Maddie Kitchen, and I run Sobriety Films UK. We are a CIC social enterprise, and we use film to champion recovery from addiction, mental health and trauma. I'm a lived experience person, so I'm 19 years in recovery from alcoholism, excuse me, and I've also suffered with severe depression. So we set up in 2019, and it was 6 months before COVID. So you can imagine it was a bit of a nightmare. But we have gone from strength to strength. We're very niche, obviously. We use creativity to try and improve people's mental health. And addiction and mental health go hand in hand. There are a lot of people who have dual diagnosis, including myself. That was what I was diagnosed with. So what do we do? Gosh, so we make films, we run filmmaking workshops, and I've just become the new creative director of the Recovery Street Film Festival, which is amazing. So this is what we do. We have struggles. We've had to contract. Like last year was particularly difficult, and it's hard to rely on people to volunteer or give their skills with the cost of living crisis and stuff like that. So I feel very lucky to do what I do, and it's all around lived experience and using lived experience to champion recovery. And I didn't get the questions, David, so you'll have to ask me.
That's all right. No, because I'm going to be jumping all over the questions anyway. So I think you've all covered sort of the initial sort of idea, so where the ideas came from. I guess what I'm interested in is how you tested that idea. So how did you see that there was a need, that there weren't alternative organisations fulfilling that need, and know that there was a market for what there was that you needed to offer? Jamie, I can see you nodding. So if I come to you.
Yeah, so I mean, we went through quite a process actually, and trying to make sure Men's Pie Club was going to do what we wanted it to do, and so we tested it very, very early. We were really, really lucky to get support from Movember back in the day, back in 2017, I think it is. We presented the idea to them as part of a program that they were developing at the time. I think some research came out which ultimately highlighted an overall dissatisfaction for men with both the quantity but also the quality of their friendships and their social connections. And it really highlighted the importance of strong social support networks to mitigate against factors such as anxiety, depression, and obviously, unfortunately, suicide as well, where I think 3 out of 4 suicides are by guys. So we came up with the idea of Men's Pie Club. We pitched it to Movember. We got some initial funding to develop the idea further. And we went about a process of basically we co-designed what Men's Pie Club was going to look like. We spoke to, I think, a good 40, 50 guys in Newcastle, as well as potential referral partners, as to what a pie club would actually look like and whether it was actually a good idea. And we got a really positive response. The majority of the guys came back and said, yeah, I don't know many guys that don't like a pie. It feels like that could be a really nice informal way of engaging with men. And so we tested it, and I think one of the things we put in place at the very beginning, which was really important actually, and I would really recommend if other organizations to think about this at the very beginning. But we put together, and again we had support to do this, a really robust monitoring and evaluation framework. We really wanted to kind of show that we were having an impact. And what I mean by that is on a practical sense, questionnaires both before and after attendance, and just trying to track the impact that we had on things like mental health and well-being and life satisfaction. So gradually over time, we've done that. We've been able to prove that it's had that impact. And with that, that's enabled us to open more clubs and get more support to develop it even further and scale into new communities.
Has your impact evaluation evolved as the organisation has evolved?
Yeah, absolutely. It has, and 7-8 years later, for example, we've just redone our theory of change, which has been a really interesting piece of work. And again, when I went on the Health Accelerator program with Maddie and Anatole, we had a session which was focused on the theory of change and monitoring impact. So that was really, really helpful for me actually. And it's just been really nice to see how how our monitoring and evaluation efforts are just starting to evolve as Men's Pie Club evolves as well.
Anatole, I'll ask the same question to you. So what did you do in terms of initial market research and testing the idea?
Well, yeah, so living in and breathing delivery of sexual health services, you'd meet patients, for example, who'd come in on a Monday with, having had their first episode of herpes all weekend, and they didn't realize there was a clinic open on a Friday afternoon or a Saturday. So when I started SXT back in 2011, actually, it was the first idea of it. I built a website and just said, look, this is where services are, because I didn't know as a consultant where services were available. In fact, I used that evidence to open our 7-day-a-week service in Guy's and St. Thomas's, because I realized there was nowhere open on a Saturday morning. There was nowhere open on a Sunday across the capital, the biggest city in Europe. So yeah, then I started mapping service provision and started using, making sure people could find local appropriate services. And then we had a share function within that, and people were sharing data saying, oh, you should go to this clinic because I've just been diagnosed with chlamydia, right? So people were using our platform for partner notification. And I had a chance to, I had only a finite amount of money. So, a number of grants initially funded this. I had a finite amount of money, and I thought, well, do I book an appointment system, or shall I go for partner notification? And the latter wasn't financially probably the best choice, but it was the one that was most important because people were finding it really difficult to do that. But we've always had outcome metrics, simply because I wanted to prove to myself it was working. So even though our system's completely anonymous, we can see when partner notification has started, we can see that the person has opened the link, we can see how many partners they've told, we can see their partner's journey into services, even though we don't know anything about them. And so we can actually, in real time, tell the clinic, we've got X number of partners told, and we know how many have tested. And of course, that makes it so much easier to then have conversations with clinics and say, well, look, why don't you use our service? Because we know we can save at least half your staff time to deliver outcomes that are twice as good as the national average. So, that's helpful metrics to then have that conversation. And then over the years, because we've been able to establish how much time we save for the staff, we can then use that to inform the pricing, right? Because we know how much it costs to deliver those services, and half that time's worth X, and the only fair pricing you can have is X divided by 2. So that's where we came up with that pricing. And it's it's a challenge getting people to open their wallets to pay for a service, right? But you need outcome metrics for them to see in real time it's working.
And Maddie as well, sort of that initial idea and how you tested it and knew that it was something that was going to stick.
So I used to work at the Media Trust, and I started there as a volunteer, and then I moved up to researcher, and then to assistant producer and director. So I knew as a filmmaker that you could, there was a market to produce films around social issues. And also filmmaking workshops. So that was really kind of where my grounding came in social film. And then I would say, there's other very successful social enterprises like Chocolate Films who offer charity filmmaking. But there wasn't anyone that I could see that was specifically doing recovery-based stuff. I did see, I think it was in about 2017, I became aware of the Recovery Street Film Festival. And then I started doing filmmaking workshops at a NHS drug treatment centre. And then I became really aware of how I could actually implement it, into the healthcare system as an alternative to like just throwing sort of medication at people. And trying to understand people as holistic beings. And there's a lot of stuff about using the arts and creativity for health in general. So that was where the basic idea came from. As I said, we started just before COVID, so we did a lot of online workshops during COVID. And it's it's a slow build. It's a slow build, and we are very small, grassroots, community-led CIC. So, like the other guys, they seem like really developed. Like Jamie has had this network in place for quite a long time, and Anatole is obviously a healthcare professional, so it's really been about me building the network, getting in touch with the right people, meeting the NHS, commissioning teams, public health, and getting the word out there. This is what we do. And with Recovery Street Film Festival, that's moving us up into a different level, which is really, really exciting.
And that must take time, particularly when you're navigating, a structure like the NHS. Firstly, identifying who the right people are to speak to, but then being able to get through the door and have an opportunity to speak to them.
Yeah, so we were lucky in 2022. I was approached by Rethink Mental Illness and for a co-production project, and that was around the Northwest London Suicide Prevention Project. And we did a filmmaking workshop using 15 people in addiction recovery who had gone through times of suicidal ideation. And so that really got us in, with Northwest London ICS. And then people sort of knew about us more. And then I think we also did a module, didn't we, in the Health Accelerator about how to get in touch with commissioners and stuff like that. That was really, really helpful. Yeah.
Jamie, how did you go? Because you mentioned that you've got, the medical professions referring people to you. And I think that can often be, I remember, this is going back a few years ago, but, the first talk of social prescribing. And I think a lot of social enterprises thought, well, this is what we need. This is going to be GPs referring to our services. But then what happened was that the social enterprises couldn't get in front of the GPs, or the GPs weren't aware that those services existed. So how did you tackle that?
Yeah, I think, given that Food Nation has been going for quite a long time, I remember when we started in 2005, we were literally a tiny community project based in Biker, Walker in Newcastle upon Tyne. And I think at that time, I just started to very, very gradually build my network by literally knocking on the door or dropping them an email and just, trying to have a conversation with them about what we were trying to do. And obviously back then we were working on Men's Pie Club, but gradually that network's kind of built over time. And so when we came up with the idea for Men's Pie Club, I already had a lot of contacts in the local area, that a lot of GPs and other health professionals that I was able to call on. And I think more recently, what's been really good for us, again, going back to monitoring and evaluating or showing that we're having an impact, we've gone back to a lot of those contacts and asked for their feedback on Men's Pie Club, things they like, things they don't like, areas for improvement, etc., and put together some really kind of nice, very simple social impact reports aimed at referral partners. So because in effect the feedback has been from referral partners, that's quite attractive for potential new partners to obviously see. So that's really, really helped us. So really tailoring the information specifically for those guys has been super important for us to then get our foot in the door in a new community, in a new area. So yeah, that's one area that has worked well for us, I think.
I think if we come on to probably one of the key areas, which is funding and who pays for this and how you generate income. Anatole, you mentioned that you came up with some pricing. Who is your customer? Are you selling to the NHS? Are you selling to service users? What's the model that you've got? And I'd also be interested to know your journey from the start, and how your trading income has evolved as you've grown.
So initially it was all grants. Guys in St. Thomas's have a charity, and I pitched to them and got some funding from them. The first, I got a loan from Big Issue Invest, UK Health Security Agency, as they're called now. They funded a few pilots, the Cabinet Office as well. So yeah, a number of different routes for funding. When I came to pricing, I just didn't know how to price this because nobody was in the field, nobody was doing this. There were a few free websites trying to do a similar thing, but they didn't have any outcome metrics. They weren't embedded in how clinics operate. So they were there to try and support patients, but they weren't really integrated in the delivery of healthcare, and they couldn't support partners to access care, and they weren't measuring outcomes. So yes, I initially grants, a lot of it I've worked for free for it, because it has been my side hustle. I can only really count it being my main hustle if it grows big enough, and I can do that. I've also loaned it money, so I bootstrapped it, as they call it in there, which is because I've have faith in the model. But it's only really recently that we've had enough data to show how much value we add, and therefore we can adjust our pricing. And the best way of really adding value to your service is measuring the value of your service and then pricing accordingly, because I think a lot of people undervalue their service and don't realize how much they really are worth. And yeah, so we upped our pricing, and people accepted it because we could justify it. And then moving forward, I've then turned around to clinics and said, look, you're having a real difficulty paying quarterly. Why don't you pay up front annually, and we'll give you a discount for that. And then, we had a model where we were asking for money for the partner notification tool, and then money for the booking module. And we realized actually the booking module is how we attract the high-risk patients into service. And that will, by definition, if you're a partner of an infection, you're more likely to have an infection. So 45% of partners of gonorrhea will have gonorrhea, for example, and then they'll use the partner notification tool. So we realized the booking module was actually a way of feeding the partner notification tool. So we ended up, shifting pricing around that. But as in the last year, and since doing, the School of Social Entrepreneurship course, I've really been focusing on the fact that our platform is set in such a way that we can funnel the highest risk patients into clinics. So at the moment, we have SDIs going upwards, we have money for the service going downwards, and we have people, we've only got finite bandwidth, and I think we can add lots more value to services by saying to them, look, why don't we can help you see the same number of people, but they're going to be more segmented, as in we're going to segment them by risk of SDI diagnosis, and if someone comes in as a partner of gonorrhea, for example, and you find out they're in a high-risk network, mostly men who have sex with men are in the highest risk network, but there are others, then, there's many other things we can do for them. We can give them an SDI prevention bundle where we can, put them on PrEP to stop them catching HIV. We can vaccinate them for hepatitis A and hepatitis B and HPV and Mpox. And now the Bexsero vaccine, we can reduce their chance of gonorrhea. And then the final STI prevention tool that we can give these individuals is DoxyPEP, which is you take doxycycline at the time of exposure, and that'll reduce your risk of catching syphilis. There's lots of trials showing that. But the key thing is getting those individuals into clinic in the first place. And that segmentation just doesn't happen by the clinics. They can't do that very well because it's first come, first served, and people are booking appointments, and you get the worried well crowding out the high, those with the highest need. So, that's hopefully going to then change how we deliver service and how people will look at us. So the initial, just to end, I think the initial challenge we had is everybody looked at our service as a cost center, right? When really we're a revenue center, because every time we bring in patients with a high risk of an STI, those clinics will bring in more money on tariff. They'll get more recognition from their commissioners. So we're now trying to make sure that people see us for what we really are, which is a revenue generating system that maximizes public health, as opposed to, oh, it's an add-on, it costs money, and we have to use another website,
Yeah, it's pretty interesting model to look at. Jamie, for you, has your funding taken that similar journey, sort of beginning with sort of heavily grant dependent and then moving towards traded income?
We'd like to become less reliant on grant funding. So Food Nation pre-COVID, we had a lot of trading income through other arms of the business. Post-COVID, as I said before, now we focus entirely on Men's Pie Club, and we have been really, really lucky where we've been backed by one funder, and that funder's been Movember over the last few years. And that makes me nervous, to be honest with you. It's something that I want to move away from. You know, ultimately we're a social enterprise, we're a community interest company, and so the next phase for us is very much thinking of new ways of how we can generate an income, moving away from that reliance, that dependency on grants. And I think we've built up and developed a really strong brand. And so we're starting to play around with things like merchandise, and we have a couple of other ideas as well. But again, you know, it takes time, doesn't it, to develop that. It's almost like an additional job on top of the day job, if you like, to think of creative ways of how we can, you know, generate an income that's going to make a real difference to how we run the business. So yeah, it's work in progress, but certainly, you know, in 3 years' time, I want us to be, you know, much less reliant on grant funding than we are now. Makes me nervous.
Thank you. Time and the mindset shift as well, I think, is a key one as you move towards that. Just to note, I can see questions coming in. I'm aware that we're rapidly running through the time, but I will make sure that we come to questions towards the end. And if there are others, as you think of them, just pop them in the Q&A, and I'll make sure that we get through as many as we can. Maddie, to you on funding really, and your income model.
Yes, very similar to Jamie. So lots of grants at the beginning. We were supported by my council, Camden Borough, after COVID, to do filmmaking workshops with young people who were isolated and suffering mental distress. So that was incredibly helpful. And then I'm just thinking sort of more recently, this year's been brilliant because we've been working with Islington Council, who are really behind using creativity to help addiction and mental health recovery. And we've just done a women's mural project for them, and they've supported the Recovery Street Film Festival this year. So we're going to be doing it at the end of September. Everybody's invited on the 27th. To come along. That will be at the London Screen Academy. So we've really, I think Sobriety Films has really been supported by our local councils and public health. And actually Navigo CIC was another one which we did films for suicide prevention. Yeah, like Jamie said, obviously it's meant to be 50-50. And that's a sort of ongoing project of trying to sell films to outside, you know, private businesses or private clients. And I mean, yeah, I mean, there's a lot to think about, you know, because we've now taken on Recovery Street Film Festival, about sort of monetizing that, like, I don't know, t-shirt sales. I was just thinking, Jamie, you could produce a pie that would be like in the frozen section, which people might want to buy to support your charity, your social enterprise. So yeah, one of the difficulties I didn't mention earlier, I think, is burnout. You know, and that can be a real problem because I am the sort of main person who runs Sobriety Films. It can be really isolating, and I know a lot of small CICs and people who run them have that. You know, also I am someone with a history of addiction and mental health, so I really have to look after myself. I've gone completely off piece now, but I thought it was important to add that because I missed that out.
Yeah. How do you manage that, Maddie? How do you make sure that you're not working, you know, 20 hours a day, 7 days a week? And
good question. I mean, I do. I mean, sometimes I do. Sometimes you have to. Like, if you're on a film, you're on a film, and you don't have a life. So, I mean, I have therapy. I have regular therapy sessions. I attend recovery meetings. I talk to my peers in recovery, yeah, I think it's so difficult trying to create the balance, is all I can say. It really is. And I did feel really burnt out in 2023. My sleep got really bad. And I had to take a step back. But that's the thing, is that my long-term goal with Sobriety Fields is to keep it going at any cost. And that means I have to, the social enterprise has to contract and grow with the market, but also with how I'm feeling as its leader. And then we need to recruit some other people to get involved with the film production, who are of lived experience as well, to grow. Yeah, I mean, yeah, what can I say? I love doing it. So, you just keep going, but then you do have to find a balance somewhere. Yeah.
It's a good point that you make, Maddie. I'm keen to sort of explore this more, and I'll throw this to all of you. So raise your hand if you want to come in. But one of the things that we find at SSE is that people find being a social entrepreneur quite isolating, because it's quite unique what social entrepreneurs are trying to achieve, and people can just often go, that doesn't really make sense. How important has been having a network of other social entrepreneurs like you, having mentors that you can lean on? Do you have boards and trustees that you can sound to? Who do you go working as founders when you're looking for advice and support?
I'm going to say, that the London Health Accelerator was really fantastic, because being in a room with all these social entrepreneurs together, and we were all sharing our difficulties and our strengths, was really, really empowering. That was great. I have close friends who also run social enterprises, and I can always ask them. Does somebody else want to? How do you deal with it?
Jamie, I can jump in here. For me, it's I was asked the other day, why are you doing this? And what I get a kick out of, the reason I set up SXT was because I did a master's in public health, and this was 2007, and I wrote a paper about digitizing sexual health, and then got involved when I came back in setting up SXT and then setting up online testing. And now, what are we, 20 years later nearly, we've got over nearly half of all testing in the UK is online testing. We've got digital partner notification. Things have happened, things have changed. And what motivates me is really, the public health, the patients. Meeting patients is really, the greatest thing about being in healthcare, and just, trying to solve their problems. But then stepping back and thinking, well, how do we make the system work better? But yeah, there's boards, there's the developers of the software, sounding with them, and then dealing with all the stakeholders, and just seeing what can we do to solve one problem at a time, at least, that's the grind of it. But it is hard, and it's hard because it takes 7 years for patent ideas to make money, on average. These things, that's just how the world is. It's, you've got resistance to change, you've got to try and support your own bandwidth, you've got to try and get people to collaborate and believe in you, and yeah, you just need data, and all of that just takes time. It's hard. And yeah, back to what Maddie said, the School of Social Entrepreneurs, it was just lovely to sit in a room with your tribe, and just hear their stories, and realize you're not on your own.
Yeah, and I guess just finally to add on that, I mean, it can be quite isolating, ironically. And I think one of the things that I've learned over the years is to really taking a step back and putting time into kind of building that support network around you. So I've got various mentors who, a lot of them have become friends, various mentors. I've always had a coach as well, and I've, you know, put time into investing into those relationships, so I can literally call on people to give me advice on various different areas of the business. So I think that's, yeah, it's been really important to me and will continue to be so. Again, just very quickly, Deb, going back to your point before about grant funding and moving towards trading income, I think one of the key things for us next as well, you know, I spoke about merchandise, and Maddie, I love your pie idea and what have you. There's so many different ideas that we have. We're thinking about a book at the moment, obviously recipes and all the rest of it. But ultimately, what, you know, a lot of the work that we've been doing, again, I'm sound like a broken record, but the monitoring and evaluation has been really, really important, and having that social impact and being able to put that into numbers and prove that we are having an impact is super important for the next phase for us. So using that to go directly to public health commissioners, for example. So we're working with a borough council in London at the moment who are about to commission us to open 2 clubs in London, which is amazing. The reason, well, a key reason for that is because we've got that evidence base now. And so that's, you know, part of the plan for the next phase is to try and get more commissions, and moving away from that grant funding reliance. So yeah,
it's come through really strongly in all of your answers about that measuring and monitoring. Jamie, I'm interested, just as an aside. So, in impact reports, you quite often see things like, for every £1 invested in this service, it generates £7 of savings to the state, or to, you know, do you use that sort of social return as because I always think how effective is it as a messaging device?
Yeah, do you know, we don't use that, and it's something that we are starting to look into, social return on investment, I think it is, and there are various people or platforms out there that can help you kind of come up with that data. But I think that's going to be probably a really important part of our next stage of monitoring and evaluating that impact. Can we put a value on it, similar to what Anatole said earlier? And I think that's going to become more. I think that's an important phase for us, and on the journey of showing our impact, actually.
I'm going to move, before we go to questions, I'm just going to pick off a few of the questions that I've got on my list and just run through them as sort of quick fire questions. So, question 1, what does a more supportive ecosystem for health-focused social enterprises look like? Maddie, to you. Is there anything, or do you find it pretty supportive as it is?
Oh, sorry, I just got a time lag on that. I didn't hear you very well.
Don't worry. What does a more supportive ecosystem for health-focused social enterprises look like?
Someone else answer first, then I'll give my answer if that's okay.
I mentioned it earlier, some harmonization around adoption. I suppose you know, payment on time. I noticed when the NHS moved to a no PO, no pay, it meant a lot of services then just wanted quotes, and then they sat on quotes and they didn't turn them into invoices. So, you know, I think, you know, some are better payers than others. It would be, I think, when you're a small business, you want people to turn that around. And then I think, you know, I great ideas, it's hard to get in front of the right audience. And I think, yeah, I'm still working on that. You know, how do you, you know, you get people who are your fans in the UK Health Security Agency, but how can you use that, for example, to bang the drum for public health and trying to get people to think a different way? And, you know, that's an ongoing challenge, and it'd be nice to improve that.
I think for me, in terms of a more supportive ecosystem, again, you know, I've already mentioned this. We've been very, very lucky that we've had financial support from November over the years to help us pilot, develop, and scale Men's Pie Club. I think the really key thing to point out here is that yes, they've given us funding, but actually they've given us so much more than that. They've given us support around, again, monitoring and evaluation. They've introduced us to a wider community of organizations, quite literally globally, who are working in the social connectivity world. And so given us an opportunity from, learning from our peers elsewhere. So that's really important. And I think in the future, so for example, local authorities, if they're gonna award funding to charities and social enterprises, don't just stop at, giving organizations grants, but just think a little bit more holistically. How else can you support that organization to be a success in your community? Because within local authorities and within health services, there's a lot of experience, there's a lot of expertise there, and the three of us were very lucky to have access to that through the Health Accelerator program. So just think more holistically about how you can support social enterprises and charities.
I would say to keep on investing in people of lived experience, and keep on recognizing value that they can give to their communities. It's absolutely, I think, imperative that we be involved in, with these the health solutions that we offer, and also I would say, I think maybe there needs to be more support around female founders, like we talked about isolation and then juggling, childcare, etc. And then I would say, I know that the whole sort of tender business has got a lot easier, and it's a lot more sort of person-centered now. As someone who can struggle, I can struggle with concentration and filling out forms and stuff like that. I think it really needs to be simplified and streamlined. And I'd also add that a lot of the commissions that we have got have been through word of mouth. So it's very much me contacting the network. It's a very different model to Anatole, what Anatole is doing, and also Jamie. So just keep investing in lived experience, because that is how people get well, that's how community and society gets well, I think.
Have you seen any I mean, we're only relatively new into sort of the new government's term, but there's been an NHS 10-year plan. There's been a lot of words around how healthcare is going to change, and how the shift towards more sort of preventative medicine. Have any of you seen any change in the way that you're working, or the types of commissions that you're going for over the last 12 months? And are there any sort of signs for the future?
I think so from my experience over the last few months, I know that there's more talk about that preventative focus, which is always obviously good to hear. So I have noticed that that's starting to ramp up. I think alongside that, which is really, really encouraging for the work that we're doing, is that the government have committed to developing and writing the first ever men's health focus strategy, which I'm hoping is going to be launched later this year, or the beginning of next year, of which we've responded to in the consultation. So it's, I guess at the moment it's just wait and see, really. It's all very well having a brand new strategy, but what's going to be behind that? Is it going to be investment to support more preventative focused organizations like us? I think time will tell, but it's looking good at the moment, but let's see.
I recently pitched to an internal Dragon's Den in Guy's and St. Thomas's, about using SXT in a way that brings in high-risk patients. And in sexual health, we, excuse me, we align with the 3 pillars of the 10-year plan. You know, we've moved from hospital to community. We have a lot of community-based clinics. We have even home testing, which you can't get more community-based than that. Treatment to prevention, well, getting key people in and treat them is great, but we can give that STI prevention strategy, which I talked about earlier. But the analog to digital, that's certainly something that we really focus on how do we help basically move people into a way of working that, you know, empowers the patient and allows the patient to, you know, work with the healthcare teams to let partners know and people at risk know in the community. So, you know, that 10-year plan and those pillars are really helpful in framing what we do and how we're moving forward. And it's just realizing it. You know, and that's, you know, I sense there is an appetite for that, but it's still early days.
I'm tangential, but my GP surgery has an app, and I went to use it last night to book an appointment with a GP. But you can't book the appointment with the GP out of GP office hours. I was like, what's the point of this? What's the point of that? Or anything? Maddie, any sort of change in any changes that you're seeing sort of this early on into the new government?
Yes. So anti-stigma, that's a big thing. I know that Phoenix Futures are a very big treatment charity. They run the Anti-Stigma Network, which is doing great things. And so, I mean, that's the biggest problem that we face in addiction recovery and mental health and trauma is stigma. So there is funding available towards that, and I have made a few pitches for that fund. So that's definitely something that's very positive that's happening.
Good. Right, I think that's enough questions from me. Let's go over to the participants. So I'm just gonna run through these as I can see them. It's a good one to start off, Anatole, for you. For resident doctors currently in training, is it feasible to run a social enterprise or CIC concurrently? I appreciate it might be quite a different experience as a consultant.
The answer is yes, but it takes time. And luckily, the European Working Time Directive means you're not working 100 hours a week necessarily on the front line, but it still takes time. And yeah, I suppose the trick is to build it up slowly and try and, you know, automate, relegate, or delegate lots of the work so that you don't, you know, get swamped. You need sleep as well.
Madeline, I set up a new CIC Care Assist network last month. I'm looking for additional directors who are interested in providing services to care homes, domiciliary care agencies, and disabled employers. Is that directors as in to work, Madeline, if you just come back in the chat, to work for the organisation? If it might be something where we can promote that through the SRC newsletter if you're looking to recruit people to a particular role. Jamie, one for you here. During the Pie Club sessions, are they structured at all, or is it focused to be a purely social space? I'm also interested in working with social connections and social health, and also wondering how people respond to joining that is aimed at people feeling isolated, as I feel there's a lot of stigma still around this.
Yeah, okay, so the first part of that is it's structured. Sessions are structured, and I'll just describe very quickly how a session works. I mean, again, often there's always a leader of a club session, and the first thing that happens when you arrive at Pie Club is you have a cup of tea usually, or a coffee or a drink or whatever. So there's a very, you know, warm welcome. And then everybody works individually. So if you imagine 12 guys sat around a table or in a circle, you're all given flour and butter. And so the first job is you make your own pastry. So that's the first thing that goes on. Once the pastry is made and in the fridge resting, you then work as a team to make the filling for the pie. So teamwork going on there. The filling, in terms of how that's decided, that's decided the week previously at the end of the last session, so everyone knows what pie is being made that week. once the filling's made, that's when, and probably another cup of tea, and then the pies are assembled, they're baked, and then sit down, eat the pies. Not all of the guys eat them there, and then some take them home. So that is the loose structure. So it's very, very hands-on. In terms of how people respond to joining something that's aimed at, people who may be at risk of or experiencing social isolation or loneliness, I mentioned earlier about, a male-friendly approach, and as part of that, we think very, very carefully about our marketing and communications. So we don't talk about loneliness, we don't talk about social isolation. It's very positive language. Obviously, a lot of health professionals, etc., completely understand what we're about and what we're trying to do. But in the marketing and the posters, flyers, and even our website, which is we've got a new website coming out next week, we're very careful about the language that we use, because we are aware of that, unfortunately, that stigma around being lonely. So we don't want to put, obviously, potential members off. So we put a lot of time and effort into thinking about that.
Thank you, Jamie. Question from Diana. We've been supplying a service to the NHS for 3 years now through grants and fundraising. What kind of data do you need to move to the NHS providing this funding, and/or which people do you need to get in front of? I imagine it's slightly dependent on the organisation and the service it delivers in terms of data. But anyone want to come in there, and particularly which people do you need to get in front of?
Is it what area is it? Is it regional or sorry, London or?
Diana, if you're still there and you're able to type into the Q&A. And so you look like you were going to come in there.
Yeah, I was going to say, I was wondering who's getting the value of the service, and do they have their own budget? I've been focusing on the clinics where partner notification is initiated and where they're seeing people with diagnosed SDIs. But there are people above those clinics, in trusts, who are, say, financial directors, who are looking at the bottom line, and they're key people to ideally get on board. But they tend to, it's difficult. Yeah, I've had experience where commissioners have commissioned us and they've told clinics to use us, and people don't like being told what to do. So, I think it's finding the payer where they're seeing the value is, I think, the easiest. It just means that scaling is a lot harder in that context.
So Diana says that it's in the Wirral in Liverpool, and it's the NHS, I'm going to say CAMS waiting list, but it could be CA MHS waiting list. That is any more use.
Yeah, I'd find out what that journey is, map out that journey of, if you're addressing waiting lists, who's benefiting. Our clinics, supported to see individuals, it's just trying to work out where the value is being really provided, and then hopefully you can extract the money from them. Yeah.
Building a board is difficult.
Yes.
I can see nodding, lots of nodding. What advice would you give to people, any of you, to building a board and then working with that board?
I guess for me, almost like taking a step back and just thinking about, well, first of all, really understanding what skills you feel like you need on your board first and foremost. So that's really important, understanding what you need, and then reaching out to your networks, your mentors, coaches, whatever, and to, for help and support. And I guess the other thing I would say is maybe not rushing. as well. Take your time, get to know the people that that you're approaching, to really understand whether they're the right fit. It's just like recruitment, right? Employment. So take your time. Yeah.
Our CEO Ali, he says the big mistake a lot of people make when building a board is when they first do it is they just put their friends there, and actually that's of no use whatsoever, because you do need people who are going to be critical and challenge what you're doing and just not everything through.
Yeah, 100%.
Perhaps more of a signposting question for the stage before applying for a course at SSE. Is there anywhere to get advice or information around whether a social enterprise is the right structure for you, taking into account all the really useful insight discussed today? A good question, actually. What led the three of you to deciding that social enterprise was the sort of the route that you wanted to go? Maddie, if I start with you. Oh, Maddie, you muted yourself. You took yourself off mute onto mute.
I know. I was just answering a question there. Social enterprise, because so I learned about social enterprise when I was working at the Media Trust as a model, and we did a lot of films about social enterprise, and I learned a lot about it then. And then in 2017, I did a project with Camden. And that was about finding a social enterprise that could be in the addiction treatment NHS arena. And that was three of us. We were all lived experience, and we researched all the social enterprise models, and how that could be put into the system and make money, and have that obviously social value. And we came up with the idea of having peer mentors. And training peer mentors, and that was in 2017. So I know, I don't know whether that was the first time that peer mentors came up. I know that they're quite that's well covered now, quite well covered in addiction treatment recovery. So really, it was I knew exactly what social enterprise was. I am being someone of lived experience. I want to use the skills I have to have a good social outcome, and that was the model that I knew about.
Jeremy?
Yeah, I mean, again, it's been a few years now since we set up Food Nation, but again, I really didn't want to become reliant on grant funding, and we just felt that the services that we were, or the projects and services that we were going to come up with and deliver, we just felt that they had the ability to generate an income, and so a social enterprise model was right for us. So, for example, we set up a sustainable restaurant business in the Northeast, which was generating a large amount of income for us before obviously before COVID hit, and various other services like a cookery school as well. So yeah, it was the right model for for us at that time. But it's funny, isn't it? Because now we are, as I said before, really quite reliant on grant funding with Men's Pie Club, but there is that serious appetite to move away from that and get ourselves in a position where we can start generating income from elsewhere.
It's interesting because there is a whole other side to the market. So when we've recruited for health programs previously, we've often looked at universities as a sort of route to market, thinking there must be loads of great enterprises coming out of universities. And I experience, some of them will be social enterprises, but a lot of them will just be set up, we want to take in, traditional investment and give away equity. And so that's the model that they've gone through, that sort of company model. And I think at the heart of it, it does often come about where you want to get your income from, the model that you go for.
Yeah.
Well, there'll be another London Health Accelerator, but is it limited to specific boroughs? Will that be extended across London? As people, I'll do this now because as Jeremy, Anatole, and Maddie have mentioned, they've all been on the London Health Accelerator programme. It is a program that we are currently recruiting for. As you can tell, it is a London-based program, but we thought there's enough knowledge here to broaden this out to people sort of beyond the pool of potential participants for that program. So it's currently limited. So it's open for recruitment now. The application closing date is 29th of August, and it's open to anyone working within life sciences, within healthcare, who's really looking to take their organisation to that next level. So there's a number of months of free learning attached to it. There's the opportunity to apply for a £5,000 grant, and the content is really aimed at health-focused enterprises. It is open to organisations working in Camden, Hackney, Hammersmith and Fulham, Islington, Lambeth, Southwark and Tower Hamlets. To answer the question, will it be extended across London? I really hope it will at some point. We are tied to where the funding is available to deliver that programme. So those councils have put money in to fund the programme, and that means that that's where we can do it. So it would take us to get other funding to extend the programme elsewhere. Fingers crossed that will happen, but it's not a promise that I can make, I'm afraid. But do apply. I'll send out details after. If you are in one of those boroughs, do apply. It's a brilliant programme. And you can see the results today. Maddie, go on.
Yeah, David, I was going to say, I didn't say earlier, one of the brilliant things about that course was that I got an excellent mentor, Jodie Eastwood, at the Knowledge Quarter. A self-made businesswoman, and what a powerhouse she is, and she gave me so much encouragement and support, and we're still in contact now. So that was a really, really helpful part of the accelerator.
Question here. What sort of timeline did it take you to really get services set up and providing for beneficiaries? I feel like really is a very leading word there. Anatole.
So I suppose it took a year or so to get a good website and signposting and get clinics in there. Then I populated it with a national database, then got other people involved. But it took 5 years really watching it grow and thinking about it before we built the partner notification tool. And then, it's 2 years after that, we built the booking module. So yeah, these things take time as you start learning from your customers and what works. I suppose really, I know, is really when you're actually in the black, which we should be this year in theory, not that we've paid off necessarily all the directors' loans and stuff, but yeah, no, it depends. I didn't answer the CIC question, but I set it up as a community interest company limited by guarantee, the most conservative model possible, because I thought it would assuage my anti-business colleagues in the NHS, and there's quite a few anti-business colleagues. I think people find it very difficult talking about health and money for all sorts of reasons. But the reality is, healthcare costs money. Staff cost money, drugs cost money, properties cost money, diagnostics cost money, everything costs money. And, I think having conversations about money in healthcare are uncomfortable for folks. And so anyway, I set up this really conservative model thinking it would make people more open to having these conversations. And I realized it made no difference really. But, making a company with shares and getting people investing and thinking about an exit is not really something I was set it up to do, right? So, a traditional company is, oh yeah, we're going to exit in 10 years, we're going to get bought out at X, 10X or whatever. But, it's social enterprise is about setting up a business that's going to make a difference, and you've got to make money to sustain, but I don't think anyone sets up a social enterprise to become rich. And if you are, you're going to wait a long time.
Very long time. Jamie, Maddie, for you, what was that sort of timeline to get services set up? I think it's a bit sort of how long's a piece of string this, because it is very dependent on the organisation.
Mm-hmm. I mean, again, thinking specifically about Men's Pie Club, you know, from coming up to the idea to pitching it to getting that initial support, putting the monitoring, you know, the evaluation element in place, getting the team around me to help develop it. It probably took about 9 months actually before we opened the doors of our first ever club, which I think attracted 7 or 8 guys. So that was back in what, 2017, 2018. Fast forward to present day, I think we're now on 33 clubs. So it's, you know, taken us that time. I'm hoping that by, you know, in another 3 years' time, we'll be at nearer 80 clubs. So, you know, over 10 years, yeah, yeah, taken quite a long time, really.
Similar for you, Maddie?
I think it's been a bit supply and demandy, to be honest, because we're quite niche. So, I mean, we would have been able to, you know, produce films and probably within a year. And then it's really like what comes in, you know, what do we need to do here? What projects are being offered? And then finding the right people to work on them. So, I mean, we're still scaling up. That's the truth. And, you know, we're never going to make loads of money, that's for sure. But, you know, we have a really good social purpose, and I'm going to keep doing it for as long as I can. And we've never been in debt, which is fantastic.
That it goes up and down, doesn't it? Sort of in terms of scale and in terms of reach, and it's not a straight trajectory. It's really...
You have to be flexible. You really have to be flexible. And, you know, for someone that suffers with anxiety, it can be really trying. It's really quite difficult at times. But I've learned to kind of take a step back and just, you know, whatever's happening in the market or with funding or, you know, or being, you know, reflected in society. Those are variables that I can't really control. So I'm kind of going with the flow and trying to pay myself a wage and yeah, and keep it all going.
And in terms of that sort of initial startup, I mean, a huge number of students at that level will just be looking to pilot something and build an evidence base and just show that there's need there. Without setting up a full organization, and they'll use that pilot to learn and to sort of refine what they're offering and then go to the next stage.
Yeah, no, definitely. And I think the other thing I would say as well, from our experiences, you know, one of the things with Men's Pie Club is it really is, you know, I described a session before. It sounds and is in many ways a very simple approach. You know, just getting guys in a room to make pies. You know, it's what's difficult about that. But actually, especially the last couple of years, the work that the team put in the background to make sure that we can do that safely and effectively, monitor the impact yet again, think about safeguarding, all of those things, the documents, the policies, the procedures, how we work with partners. You know, there is so much work that goes into all of that. And I guess I would just urge anyone that's got an idea and is developing something, you know, do spend time on that. It's really important because when you do get to hopefully an exciting stage where you are able to scale, having all of that there done ready will give you the confidence and give partners the confidence to invest in you as well, to go to the next level. I think that's one of the key things I've learned, I think.
Got one final question here. We touched briefly on social prescribing earlier, but have any of you worked directly with social prescribers? If so, how did you reach out to them? Also, do you know if the services offered through social prescribing need to be free, or can they be low cost as well?
Can you give me an example of social prescribers? Sorry, Anatole. David.
I mean, I would have said a GP was a social prescriber.
Apart from GPs.
No, I can't.
Okay.
Anatole, I'm going to come to you with the healthcare background.
Yeah, I've primary care are best placed, but we do refer from sexual health clinics potentially, but and from my HIV clinic, we've done a few, sort of YMCA gym, for example. I can think of one example, but it's hard to see that working as well as, say, a regular prescription, a medication prescription. I think there's obviously a lot more familiarity in that. It's a course of antibiotics and it's for so many days and it's very easy. When it comes to social prescribing, you need to make sure that the person is the right fit. You need to make sure where they're going is going to be fine for them. So I'm just thinking of the tightrope that Jamie's walking, which is men don't want to be seen they're going there because isolation and loneliness, but at the same time, if someone identifies that, it's how do you do that in a positive way that's empowering for them and they actually feel included and they don't feel ostracized. I'm in the most stigmatized area of healthcare, which is sexual health. Nobody writes their MP and says, look, I had a terrible case of gonorrhea and I couldn't access services, or I had an abortion and and the service wasn't that great, because they're really difficult areas of healthcare to have open conversations about. But what we've created is a way to anonymously engage the at-risk sexual networking community, and then alert them where local appropriate services are. So we're doing sort of, it's sort of public health prescribing in a way, and alerting people that they need to get seen and then bring those people into care. And the big challenge we're having now is just how do we help clinics open their doors specifically to the target audience we've identified.
And then, yeah, from our point of view, lots of GPs refer guys into us, so that's an example of social prescription. Community mental health teams, other community voluntary sector organisations as well. In terms of do they need to be free? I don't think so. I don't think there's a need for them to be free. Men's Pie Club is free, actually. But one of the things, again, that I'm keen to have conversations with, I'm keen to have more conversations with social prescribers on, is would they be willing to pay, would the prescribers be willing to pay us a fee for prescribing patients to us? And I think that's an important question and something that we want to do more work on. Again, it's that whole area of income generation. So yeah.
Things might be free to the person using a service, but it's not free because there's a cost. Someone's got to be paying for it somewhere. So I guess even if your service is free to the user, well, what's the market that's actually going to pay for that? Because otherwise you're running a loss and your organization will very quickly stop existing. Absolutely. Unless anyone's got a final. Oh, hang on a minute. There's Madeline. There's a national network of social prescribers and local networks, and GPs don't have time, so they use social prescribers embedded with their practices. Okay, that's interesting. Unless anyone's got very quick fingers and can type a question in the box, we are approaching time. It feels like it's very sort of behind the curtain, as we were sort of prepping for this. I said to everyone, 90 minutes seems like a long time. So if we end up finishing early, that's fine. But it actually feels like, I mean, I've still got 2 pages of questions that I could go through and ask. So I think we might need a part 2, a part 3, and a part 4 to cover off everything. But I'd just like to thank you all for giving up your time today. It's been fascinating. I've certainly learned a lot. I hope that the people who have participated have too. I will send out details for those who can to apply for the London Health Accelerator programme. But other than that, Jamie, Anatole, Maddie, thank you ever so much. I'll let you're free to go now with the rest of your day. But it's been so good to to have 3 SSE fellows to sort of spend the time with, and you've been there, you've done that, you're still on the journey. But to share your insight for people who might be coming along with us in the future. So thank you.
You're welcome.
And thank you for having us.
Lovely. Thank you.
Great seeing you all. Cheers,
Take care,
Jamie.
guys. Thank you. Cheers.
Thanks.
Bye.
Bye bye.